You've probably seen it before, someone with a yellowish tint to their skin or eyes. And your first thought is probably, whoa, that person's sick. But what if we've been looking at it all wrong? For this explainer, we're going to put on our detective hats. Because jaundice isn't the final verdict. It's the first major clue in a fascinating medical mystery.
And that leads us right to the heart of it all. What is actually happening inside our bodies to cause such a dramatic change? Answering that question is what kicks off this whole diagnostic journey.
So, our main culprit has a name, bilirubin. It's this yellow substance that your body is supposed to process and get rid of. But when the levels of bilirubin get too high in the blood, it starts to seep into your tissues, showing up in your skin and eyes. That's the clinical sign we call jaundice, or if you want to get technical, icterus. So, our investigation isn't really about finding jaundice. It's about figuring out why the bilirubin is building up in the first place.
All right, so where do we start our investigation? Well, let's look at the most obvious place first. Think of it like a plumbing problem. What happens if the body's drainage system gets all clogged up? Just picture it. Bilirubin is carried in a fluid called bile, and it moves through this whole network of tiny tubes, or ducts. If something creates a roadblock in one of those ducts, everything just backs up. It becomes a biological traffic jam, and that bilirubin has nowhere to go except back into your bloodstream.
And you can see a really clear chain reaction here. A serious blockage could be caused by something like a carcinoma at the head of the pancreas, which literally squeezes the bile duct shut. The moment that flow is obstructed, bilirubin backs up and bam, you've got jaundice. But the dominoes don't stop falling there. See, that bile is also super important for digestion, so a blockage can lead to other problems, like not being able to absorb fats properly. It all stems from that one initial roadblock.
A blockage is a pretty clear suspect, right? But what if the pipes are totally clear? Well, then our investigation has to turn away from the plumbing and look at the main processing factory itself. And that factory, you guessed it, is the liver. The liver has the massive job of processing all that bilirubin. So if the liver itself is damaged or just completely overwhelmed, it can't do its job right, and you get that same buildup of bilirubin. This is where we open up a bunch of different case files, each with its own unique set of clues. For instance, both alcoholic hepatitis and hepatitis A can cause what's called a deep jaundice. But then you look at something like primary biliary cirrhosis. The jaundice there is just one piece of a bigger puzzle that includes intense itching and even these little fatty deposits around the eyes. Each condition paints a totally different diagnostic picture. So, we've investigated physical blockages and problems with the liver, but our detective work isn't done. Nope. Sometimes the answer is written right into our DNA, or it comes from a totally unexpected external culprit. These two conditions show just how different the genetic story can be. On one hand, you've got Gilbert syndrome. It's actually pretty common. It's like a minor processing glitch that causes a little temporary jaundice when you're stressed out. But on the other hand, you have hemolytic anemia. Now that's a whole different ballgame. It's not a processing problem, it's a supply problem. Your red blood cells are breaking down way too fast, flooding the system with more bilirubin than even a healthy liver could ever hope to handle. And believe it or not, the list of suspects just keeps growing. Jaundice can even be a calling card for certain infections. Something like Legionella pneumonia might show up with a mild case of icterus. Or a bacterial infection like leptospirosis can hit both the liver and the kidneys, making that yellow clue a key piece of the puzzle. It just goes to show you how wide the net has to be in this investigation. Okay, so up to this point, we've been treating jaundice as a clue to find a diagnosis for what's happening right now. But what does this clue tell us about the future? Because when we talk about chronic liver disease, this yellow flag takes on a much, much more serious meaning. Yeah, this quote from the research is pretty direct and honestly sobering. When someone has a long-term liver condition, a rise in bilirubin isn't just another symptom. It's a signal. It's considered a poor prognostic factor, which basically means it suggests a more challenging outlook for that patient. Just think about the weight of that. In this context, high bilirubin becomes a critical warning sign. It tells doctors that the liver's fundamental ability to do its job is declining. It's a number on a lab report that carries enormous weight for a person's future. And it almost never shows up alone. In advanced liver disease, jaundice is often part of a syndrome called decompensation, which is just a medical way of saying the liver is truly failing. It shows up alongside other really serious signs, like ascites, that's fluid building up in the abdomen, or even confusion as toxins start building up in the blood. Jaundice is just the visible part of a much bigger systemic problem. So, the crucial point, the big takeaway, is this. We started this whole journey by calling jaundice a clue. And that is exactly what it is. It is not the end of the story, it's the beginning. Whether it points to a blockage, a liver problem, a genetic quirk, or a serious turn in a chronic illness, it's a clear, unmistakable signal that something needs a much deeper investigation.
It really makes you think, doesn't it? Our bodies have their own language of signs and signals. And it leaves us with one final question to chew on. What other common symptoms that we often just dismiss are actually complex medical clues, just waiting for their own investigation?